Proliferative endometrium seen in a post-menopausal woman at the age of 56. She was 10 years postmenopausal and presented with post-menopausal bleeding. So, what could be the cause of this postmenopausal bleeding? Look at the endometrium here, thickness 2.7 millimeters. But look at this triple layered endometrium. In fact, this can go for grade B endometrium. Now, around the fundus here, you can observe some clumping here, which is better seen on this sapphire mode. But there was no blood flow to this area. Not the aneurysm here of the arcuate artery. So, what could be the cause of this proliferative endometrium 10 years post-menopausal? Yes, the thickness is normal, 2.7 millimeters, but the morphology is not in keeping with a woman who is 10 years postmenopausal. So what one needs to do is to check the ovaries to see if one can pick any estrogen producing tumor. So usually cest-cut stromal tumor. And remember, the commonest among these is the granulosa cell tumor. In this age group, the adult type. But T-comas typically occur in postmenopausal women and can also produce estrogen and stimulate the endometrium. Same with fibrothecoma, especially if the thecoma component predominates. Rarely, Sertoli cell tumor, though mostly androgen producing, but some variant can produce some estrogen. So now let's check the ovaries and see if you can pick any of the affirmations. So you can see the grade B endometrium here, the aneurysm of the arcuate vessels, and look at this ovary. Typical postmenopausal ovary. Tortuous blood vessel, and the other ovary. So no lesion observed here to suggest the cause of this proliferative endometrium as far as the ovaries are concerned. So look at the measurements. Consistent with postmenopausal status. Here is the triple layer endometrium, the arcuate aneurysm. Now look at the ovary here. Apparently no obvious lesion. Even on this sapphire mode, you can see all one can see are some echogenic spots here, which may be consistent with the age of the patients. But after a TAR BSO, I observed this. I wasn't sure what it was, but this actually was missed on ultrasound. But after the surgery, I went back and reviewed the images, and I observed that this area here is actually this nodule on the surface of the ovary. Here you can follow the wall of the ovary here, this way, and you can see this elevation here. So this elevation, which was missed on ultrasound. With this sapphire mode, look at it here. And what was the histological diagnosis of the ovarian nodule? Fibroma. But in the literature, we know that fibroma do not produce estrogens, except if it is a fibrothecoma. So is this a case of a fibroticoma that was missed, or actually a case of fibroma? Even a case of fibroticoma is unlikely to be missed because the ticoma component would predominate, and that would explain the proliferative endometrium. But here we have diagnosis of fibroma from this nodule with a triple layered endometrium. Same patient, you can see this aquatic vessel, aneurysm of the aquatic vessel here. So here, if one doesn't have access to Doppler, one could mistake this for a myometrial cyst. But if you look at this, it's a normal aquatic arteries. We'll look at this dilatation here, aneurysm of the aquatic arteries. So thank you very much for listening.